So the second wave of COVID-19 is expected to hit Gauteng hard in the coming weeks. It's a daunting prospect for medical staff. Gauteng Health MEC Nomathemba Mokgethi joined them for a candlelight meeting last night at the Charlotte Maxeke Academic Hospital in Johannesburg. Our reporter, Tshegohaco Moagi, is covering that story for us. Tshegohaco, thanks very much indeed for talking to us. I want to start with the most important element of this. I mean, we've been celebrating and holding the health workers in high regard, most of them facing the daunting task of having been exposed to the risk of COVID-19 and the frustrations and burden of handling such a huge responsibility ahead of them. What's the sense you were getting from the MEC on the plight of these health workers at this particular hospital?
Well, Devin, good morning. And she really saying that she's very grateful to the health workers for the work that they've done during COVID-19 and trying to assist each patient that walks into the hospital, of course, at Charlotte Maxeke. The health workers themselves as well, saying that although they are tired, a very strenuous time for them, they are saying that they are also very pleased that the president did decide on this lockdown level 3, adjusted level 3, in order for them to be able to deal with mainly the COVID-19 patients and not have to worry much about the trauma patients that actually come in due to the various reasons that we know, such as alcohol. So they did say that they are very pleased with what has happened. The MEC as well saying that she really lauds them for the hard work that they have done during this COVID-19 period. She is also obviously very heartsore of the people that we have lost during this period, also specifically healthcare workers. At Charlotte Maxeke, we understand that they've lost about 7 healthcare workers there. So she also just saying to them, just really just thanking them for putting their lives on the line like that and risking their lives on a daily basis to go into work and to actually work. And just mentioning that issue of the trauma units, we see that at Chris Hani Baragwanath Hospital, there aren't any patients in the trauma ward. So the lockdown level 3 was really needed just so that the healthcare workers can actually fully focus on the COVID-19 patients. But let's just take a listen to what the MEC had to say to healthcare workers yesterday.
We are ready, and we have ICU beds, we have high care beds, we have ordinary beds that can be able to admit patients that can come with COVID. So for that, I put my head off CEO and the rest of the staff. And I think all of us understand when we say frontline staff, we don't exclude the porters, we don't exclude the cleaners, we don't exclude the nurses, we don't exclude the doctors, we include everyone. And for the 7 frontline workers that passed on in this hospital, today this candlelight is about you and about every frontline worker in the whole province.
Well, Mokgethi will be in this job for about a month, if I'm not mistaken, and that month is marked tomorrow. Do you get a sense of a committed, firm, well-strategized leadership in this province? It's a province with a huge population. That's a risk already. And we know that it's a hotspot already. So just having that sense of a great leadership in terms of health and an effective one is massively important. What's your sense you got when you were at this event?
Well, it does seem that she's getting information. So she's being given information, of course, by the people that report to her. And when I asked her various questions, she spoke a lot about the reports that she's getting from people, having meetings with CEOs of various hospitals about what their plans are. It is quite concerning that I did mention to her that, I mean, a lot of people work in Gauteng. It's going to be messy. We must just be honest about it, that a lot of people are going to come back. There's going to be a large increase of the cases we are expecting come next week, come the week after that. So in the coming weeks, we are expecting an increase. And I did ask her if she's concerned about this particular mess and how, if the hospitals are ready to handle this. She said that she is satisfied with what she has been told, that hospitals are ready. The main problem that she is worried about is that nurses are fatigued, that they are extremely exhausted, and also the fact that private hospitals are the ones that are actually packing up now instead of of the public hospitals. But of course, we do know that a lot of people will be streaming back in, and those public hospitals, as empty as they may seem now, they could fill up and fill up really, really quickly. I asked her if she's satisfied with all the work that has been put in by the hospitals, all hospitals, not just the public ones, but all hospitals, and this is what she had to say to us.
I am satisfied, unless if something drastic happens and then there's an influx, then we'll have to rework our plan and make sure that we commission. I think we have decommissioned 2 areas. I think it is it's Telkom, SLN Park, and the other one is Telkom. Yes. So those we decommissioned previously. So now with the second surge, it will depend on the number of admissions that we are going to get. Then we can be able to activate those and then start admitting patients there.
And the coming weeks are going to be crucial. And you're going to need that strategy in place. Like you mentioned earlier, Tshegohaco, you will get people, although not many have gone to the coastline for a holiday this summer, you're going to get returning residents into Gauteng. So what happens over the next few weeks, the next few months, as far as healthcare preparedness is concerned, is crucial. What's your sense on the strategy from that leadership going forward?
Well, I mean, from what she said to us, saying that, I asked her what is the plan, you know, what is, and she kept saying that they've got this plan, they've got this strategy in place. And I asked her to just put us in her confidence and give us more details of what this plan is. And she mentioned a communication strategy, meaning they'll be going out into communities to remind people of the regulations, to remind them of wearing their masks, of sanitizing. And then, of course, the big problem is the hotspot areas. And she says that although hotspot areas now and then, there'll be a hotspot area today, and tomorrow it's not a hotspot area, but they'll also be going into those areas to ensure that people remember what they need to do during this time. But what really got to me, and I kept trying to push for that answer of what is the healthcare services plan? What is the health system going to do when people start streaming back? And it was really difficult for her to give us that particular response, but they are working with the Department of Community Safety, and this is how they'll then be rolling out this communication strategy plan and everything else that they have in mind and that she says that they have as a plan. They'll then be rolling these out in communities in the coming weeks.
Tshegohaco Moagi, for the moment, thanks very much indeed